Hi, folks. I'm Bob Schrupp, physical therapist.
Brad Heineck, physical therapist.
We're the most famous physical therapists on the internet.
In our opinion, of course, Bob.
Best exercises for sciatic pain relief, herniated disc, and or spinal stenosis.
Right. You can get the same symptoms, pain down the leg with all of these diagnoses.
That's the common denominator.
Right, but the big thing is how do you cure it?
Yeah, because the thing is, with each one of these, quite often you may do something quite different.
Right.
We didn't mention piriformis.
Bob, how could we forget the piriformis?
Piriformis is another thing that can send pain down your leg. So it's a little small muscle in your butt that can cross over the sciatic nerve and put some pressure on it, and it's not good.
I like to say buttocks.
Okay, good for you, Brad.
Bob, there's some people out there we forgot about.
Oh yeah, if you are new to our channel, please take a second to subscribe to us. We provide videos on how to stay healthy, fit, pain-free, and we upload every day. Also go over to Facebook because we're bringing this back now this week. If you like us, an angel is going to get its wings or a devil is going to get its horns. Oh yeah, Brad, you forgot. I forgot. There we go. A lot of people don't know where we're on Facebook. It's Bob and Brad. Just look for Bob and Brad on Facebook.
Say no more.
There we go. Good job, Brad. Boy, you're right on the ball today.
Yeah, well, Bob, you know, once in
Sometimes.
a while we get lucky and that happens.
All right, let's start talking about the first one, Brad. We're going to talk about a bulging herniated disc.
Right, so you've got that pain going down the leg. As a matter of fact, just yesterday I treated a woman with this all the way down to her heel. And you know, you need to figure out, what's it from? And as a therapist, we're thinking right away, there's a number of options we just mentioned. But in her situation, sitting was very much irritating. Going from sit to stand, she could hardly bend forward. In her case, bending backwards was very uncomfortable. And the symptoms were classic. So I went through the evaluation, and the first thing, actually it was the second thing that I tried that she can do at home to help alleviate the pain was traction.
Sure.
In other words, pull on the spine. So here's, Lonnie, can you catch this bulging disc right here? This is just a model of our spine with the red bulging disc. Now, Bob, can you pull on those two femurs down there?
So if we pull
this
put a
way,
little pressure, it's going to pull the bones apart and take a little bit of stress off the disc. And hopefully, sometimes what they used to say is it provides a centrifugal force.
Oh, really?
Yeah. I know you don't believe that, but it does.
Centrifugal force.
Yeah.
One way or another, if we can get the pain out of the leg, we're doing good. And this is exactly what happened to this woman. So
this is something you can do throughout the day.
Sure.
I mean, you don't need to do it like once a day. You can do it every hour if you like.
So what you do is, if you got two good sturdy chairs, just like this.
You said she did it with a walker.
Right, yeah, because she didn't have a good setup, and I had a walker that wasn't, it worked out well, and I just let her use a walker. She's going to take it home and use it for a while, and when she gets better, you know, hopefully she'll bring it back. And this is all she's doing. She's locking her elbows out and kind of relaxed in the stomach muscles. And right now I've got very little toe. You can see the weight through my toes and feet are very minimal.
Yeah, you don't have to lift the legs all the way up.
Right, you don't have to do that.
Right, and she was an older lady or not?
60 years old.
So, and she's able to do this.
She's young. And she was doing this, and immediately the pain in her leg went from a 4 down to about a 1. And it's just, you know, you could just tell by the look on her face. It's like, oh, that feels good. Okay, and so with her, and when she put weight back on, it would come back. But with her, she's going to do this throughout the day, every hour, and she's going to hold it for about 30 seconds until her arms get tired, and do that a few times. And then she's going to start doing the next exercise.
Sure. Should I show that, Brad?
Yep, go ahead.
So along with this, and again, throughout the day you can do this, but and a lot of times people have trouble getting down and doing this during the day. That's why that's a nice option.
Right.
But if you're able to, you're going to want to be able to do these every hour too.
Sure.
And this is the McKenzie technique. We're only going to briefly touch on it today.
Right.
Generally, you start off, you know, just laying prone like this, laying on your stomach, and then eventually you might just get up on the elbows. Again, you're looking for the symptoms do you want to point this out, Brad?
Yes,
the symptoms
I do.
to stop going down the leg and actually start coming on up. We're called centralizing.
Yeah, so like in this case, pain all the way down to the heel. If we can get it up, and in her case, we could get it up above the knee that day.
So it goes out of the foot, out of the calf,
Yep.
and you just feel it from the knee and up. or you might get it to the point where you feel it in the buttock only.
Sure.
But then eventually you're going to put your hands below, underneath the shoulders, and you're going to start working this way.
Right.
And this helps try to push that bulge back in, basically, is what you want to think
Precisely,
about.
Bob.
So, and eventually you can try to get all the way up, but you don't want to make sure you're not doing this. You're not lifting your pelvis up. So,
Here, now in her case, Bob, I just wanted to carry through. She's right now using the pillow.
Oh, she is. Because there's some people can't lay prone. It just doesn't feel comfortable yet, so they start off with a pillow or two.
Right. So her goal is to get rid of it, do some mini press-ups.
Yeah, can even work some press-ups like this, and then eventually get the pillow out,
Right.
and then start press-ups that way.
So-
Again, if you want to, if you know it is a herniated disc, you probably want to look up some of our other videos. Just type in Bob and Brad herniated disc.
Yep, or sciatica.
Or
We've
sciatica.
got them under the same thing. We've got quite a playlist on there, and you got a very good chance of figuring out a way to be successful to get rid of it. So the next one, if
Piriformis syndrome.
if the sitting doesn't change, the symptoms aren't consistent with the herniated disc we just talked about, this one you can try very easily. Just lay on your back and start stretching that piriformis. And what I do is I just test one side to the other. You wanna?
I do the same thing,
Okay.
Brad. So what he's saying is, it's a little muscle in the buttock, like we talked about, and what happens is, if you have one side that's involved, it tends to be tighter on that side. So very easy, the way to test it is just to go ahead and bring the knee up and to the opposite shoulder.
Right. So that piriformis muscle is right in here. So this particular stretch stretches it, and
So yeah, I do it with this side, and then I try it the other side, and this one feels much tighter, and maybe even recreates the pain.
Right.
Then yeah, that stretch would be good for you to be doing.
Right. And you're going to hold it, 10 to 20 seconds. It depends on how it responds and how tight it is. And you'll do repeated stretch. You could do the pressure on,
Yeah, pressure on, pressure off.
Yep.
Pressure on, pressure off.
Typically, up to 10 repetitions is the most you'll need at one stretch. But that's a nice way to do that. The other one, why don't you stay laying down there,
Sure.
Bob? You can do the figure 4
Sure.
with the knee up.
So I'm putting my ankle across the knee, the opposite knee,
Right.
and I'm actually pulling this leg up like
Sure.
this.
So he's doing the right leg right now.
Yeah.
And getting the stretch
And I feel
on
it.
Yeah.
It really does do it. And here I'm going on the other side and pulling that one up
This
here.
is one more, if you're tight in the hips or you're a little older, sometimes this figure 4 is a little more difficult to get the flexibility, but you can do the knee to the opposite chest for sure.
The thing that I found that worked the best, Brad, with this is,
Oh, yeah. Yep. the
is
old-
actually my sister was just suffering from this, and she had emailed me, and I said, we had given my mom one of these. This is the Pure Wave massager. It's actually does percussion.
Right.
So it works out really
Yep,
good.
it's very-
People really like this thing. Anyway, like I said, go over to Mom's and borrow it. And so she did, and she was just going to go ahead and she's going to work that muscle and massage that muscle. You can even do it in this position here.
Right.
And it's because the best success I've had with my patients is when we've done massage, Brad. And the thing is, it's very difficult to massage that area yourself, especially for any length of time, because
Right.
your hands just get too
Get
tired.
tired.
So that's why it's great to have an external device that's going to do the work for you.
Right.
So,
You bet.
So we got this listed down in our Amazon products. Again, we all love it. We all use it.
Yeah,
we all
and we
endorse it.
We give them to our family members for presents.
yeah, that's
And
right.
we know they're going to like it. So, that's how that works. And the next thing, Bob, is stenosis.
Stenosis,
Typically, stenosis is with people who are older, but certainly not always. I've got stenosis. If you got spinal stenosis, there's a good chance that stenosis is going to get involved with that. A really common symptom is if you're just standing, like grocery shop, or not grocery shopping, but shopping in a store.
Yeah.
And I'm watching my wife try, go through things, getting bored, and all of a sudden that down my leg, and I'm getting, or walking longer distances, oftentimes will cause that leg pain with stenosis. But if you bend forward like this, feels better, or you sit down, pain goes away very
Immediate
quickly.
relief. Yeah.
That's a very strong symptom of stenosis. And the nice thing about stenosis is it's a little easier to treat. Simply lay down on your back. Go ahead, Bob. You want to?
Yeah,
Oh,
absolutely.
He just got back from vacation, so he's kind of catching up on the world.
So you start off usually single knee to chest, Brad?
Yep, single knee to chest and see how it responds to that. And you can bring this knee down, but a lot of times I'll have my
Leave it
patients
up like
bring that knee up so you get a little more flexion
Sure,
in
gotcha.
that lumbar spine. But you do what feels best.
And the same with this, you can do pressure on, pressure off, pressure on, pressure off.
You bet.
And then we're going to go ahead and, maybe do the other side, single leg.
Right.
But eventually you want to try to do
Both
double
knees,
leg.
right? And with
Pressure
this,
on,
when
pressure
you do this, it should feel good if it's the right exercise. It's going to feel relieving right away. It's going to eliminate that leg pain and stretch it out. Stay down there one more time, Bob. I want to show this next thing that we did. You can take a towel roll, or if you happen to have one of the 6-inch foam rollers, this works the best. You can roll up a towel nice and tight to be about 6 inches. We got this little model we made here.
Yeah.
And we duct tape it with some red duct tape.
We put sheets and towels
Yeah,
together.
and
there
it's a nice firm rolled up
solid,
towel.
yep.
But we're going to show with this because it does work a little better with the 6-inch roll. This is from OPTP. We really like this particular roller because it's built well and it's comfortable. Now you're going to put it on the sacrum below the belt line. So it's going to be right about here. And when you put weight on it, do you feel that?
Yep. It's kind of pushing me into flexion a little bit.
Right, that posterior tilt, which opens up the gaps and relieves the stenosis. And then when you do that, it looks a little uncomfortable, but
So when you're doing this, do you start just doing this, Brad? Or do you go right to the knees right away too?
no, I'll just start like this.
That's what I was thinking.
Yep.
Yeah.
It looks uncomfortable. It actually
It's not
feels
at all.
good. No.
It actually feels good.
Yep. And you need the roll that's a little softer, not the real hard one. This one's more definitely the lower density.
Lower density,
Yep. Go ahead and start pulling one knee to the chest. And you don't have to get aggressive because it's already putting that posterior tilt on the pelvis. I really enjoy this with
And I can go with both knees to chest.
If you've got stenosis, I've got a patient that I'm working with, and she's doing this exact same stretch too. That's a different one.
I don't have stenosis, but it's still very comfortable to me.
Right.
It's not a issue.
Yeah.
I don't know how this might feel worse if you have a herniated disc.
Yes. Yep. Then if it hurts and and it doesn't give you relief right away.
Yeah, this is not something no pain, no gain. Don't be doing it if it hurts.
Right. Precisely, Bob. You're right on the money for getting back from vacation.
Yeah,
Very impressive.
Got the fog out of my head, hopefully. So, all right. Thanks everybody for watching.